The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. Brrr. Well, it's that time of year when the colder months are upon us, and that means those of us in the Northern Hemisphere are at an increased risk of not getting enough vitamin D. But have no fear, because you can harness the power of the sun with vitamin D3 supplementation. AOR offers vitamin D3 in capsules or liquid to ensure you can get your vitamin D in a format that fits. Get some today at your local retailer or online at aor.ca or aor.us. Hi everyone, you're listening to Supplementing Health, and today Dr. Stacey Shillington is joining us to discuss the ins and outs of acne. Welcome, Stacey.
Hello, thank you so much for having me. I'm so excited.
So acne is something that affects many people at all ages and all stages of life. So would you mind telling us some of the common causes that lead to acne?
Absolutely. In my patient population, I work a lot with adults that are experiencing acne specifically. There's always 5 root causes that I address with every single patient that comes to see me. Number 1, I take a look at their insulin and their blood sugar regulation. Often, if insulin levels are not balanced properly, blood sugar levels are not balanced properly, that can be something that can lead to acne. Another one is poor detoxification. Often phase 1, phase 2, the liver is not working optimally, so I have to take a look at that. And it's not only the liver, but other organs of detoxification, and also the lymph. When the lymph is stagnant, often that can be an underlying cause of acne. Poor diet. Poor diet is always something that needs to be looked at. There are quite a few foods that can actually aggravate acne and make it quite worse. So I take a look at the diet as well. The gut. The gut is a huge contributor to acne. As we know, there's such a strong connection between the gut and the skin, which is the microbiome. So taking a look at gut health and healing the microbiome is a really important part. Stress as well. That's an underlying cause that's often overlooked, but it is, it's quite significant. And then poor topical care. I see a lot of poor topical care that aggravates acne and makes it quite a bit worse. So yeah, that's the long answer to what some of the underlying causes of acne can be.
Okay, awesome. So when you say stress, I've also heard like hormones can affect it. Is that because of cortisol levels, or can all hormones and the balance of hormones play into it as well?
Yeah, so all the underlying causes that I just mentioned, all of those can contribute to hormonal imbalance. So, when somebody comes to me and they say I have hormonal acne, they're absolutely right, because you need to have an imbalance in hormones for acne to happen. But I don't treat at the hormonal level. Instead, I go deeper and I treat the major pillars of health that actually cause hormonal imbalance in the first place.
Okay. Historically, people believed that acne was due to poor hygiene. Do you know kind of where that belief came from?
Well, I don't know exactly where that belief came from. Maybe from, people that want to sell a lot of topical skincare products. I don't know, I'm just guessing. But, there is some truth to that. I mean, if you are practicing poor hygiene, if you're not taking care of your skin and cleansing it properly, and your body is overproducing sebum and your skin shedding is not regulated properly, then yes, poor topical care can contribute to acne.
And are there different types of acne?
Absolutely, there's different types. There's the deep cystic acne that really hurts and that it actually feels like little cysts under the skin because that's what it is. There's more surface acne, and that acne is red, it's inflamed, you get pustules. There's also comedonal acne, open comedones, where those are blackheads. And then there's also fungal acne, and fungal acne, it's kind of like they're like white little bumps all over the face, and they tend to be itchy and they tend to get worse with humidity and with heat.
So I know I've personally suffered from rosacea before, and so have some other people I know. So is that a form of acne? Because it can also come up with like that red, bumpy, inflamed kind of
Yes,
presentation.
yes, absolutely. And I treat a lot of people with acne rosacea as well. With acne rosacea, though, it has a very, very strong correlation with the gut. And the blood vessels in the skin actually dilate, which causes the excessive redness in the face with acne rosacea. And that it has a lot to do with an imbalanced microbiome.
That's super interesting. I didn't realize that. So when you're treating someone with that, then you focus on healing the gut and the gut lining, or using probiotics, that sort of stuff?
Exactly. So, take a look at the microbiome. Often doing some testing like GI mapping is a really great tool to understand exactly what's going on with the microbiome. And it's always my priority to take a look at the microbiome and also take a look at any foods that are aggravating an inflamed gut. Because you can't heal a gut. You can't heal the gut if you're constantly eating foods that are inflammatory. So removing foods that are inflammatory, healing the microbiome, and then also healing the actual gut, like any leaky gut, any inflamed enterocytes, that also has to be addressed as well.
And you had mentioned that poor topical care can lead to acne. So is that including certain moisturizers and makeup?
Absolutely. So there's a lot of skincare ingredients that can be really clogging to many types of skin. And, if you have a microbiome imbalance in your gut, chances are you'll have a microbiome imbalance on your skin, and your skin is going to be more vulnerable um, to many products. And it's going to be irritated a lot easier. So certain moisturizers can clog the pores. And also, what can happen is when you cleanse incorrectly, use harsh cleansers, and you exfoliate too much, that is going to be more aggravating for the skin as well.
Okay, and recent research has actually allowed us to target the microbiome in various ways to improve wound healing, restore the skin microbiome, etc. And so, can that research also be applied to healing acne and possibly acne scars as well?
It can be, and we're uncertain exactly what strains are the most effective at this point in time to use topically to heal acne, but I've been experimenting with it. I've experimented with various products, and I do see some really good results. So that's definitely an option, but there's nothing like actually healing the microbiome from the gut, because it's the gut microbiome that is reflected in the skin's microbiome ultimately.
Okay. For people who are I guess there's two camps of people, those that are pimple poppers and those that are not.
Right.
So,
Yes.
for those that are, what can they actually be doing to their skin when they're popping?
Yes, so skin picking, it can get really out of control. And there's times when you should maybe pop a pimple, and that is when you have a pimple that has a whitehead, and if you just gently squeeze it with barely any pressure at all and it releases, that's fine. Of course, you need to wash your hands and your face beforehand. But then there's also the camp where it's almost, you go and you look in a mirror and you just start going and you can't stop. And I see that so often with so many of my patients. And it's actually a deeper issue. It's anxiety related. And, it's something that we really need to deal with on a different level, right? It's more about developing self-love and, listening to the talk that goes on within ourselves and how to counteract, a lot of what we tell ourselves.
So along that same line, acne does influence self-confidence and self-esteem for sure. So how do you suggest people start to confront that negative self-talk that comes up? And is there any kind of initial steps that you suggest or tools that you suggest they use to move past that?
Yeah, so the first step is awareness. It's always awareness. It's always understanding, like being aware that we're saying things to ourselves that are hurtful and things that we wouldn't accept any other person saying to us. And, really, I get all my patients to do meditation. And, I've developed a whole program called the Beauty Bliss program, which I walk my acne patients through. And it's all about listening to our negative self-talk, getting in touch with what we're feeling and, allowing those feelings to be felt and to validate ourselves and validate our experiences and change the conversations that we're having with ourselves. And it's a process. Um, but yeah, meditation is probably my number one tool. Also leaving little notes, on the mirror, wherever you are, saying, I love you, you're beautiful, really changing the stories that we're telling ourselves.
That's fantastic. And for those that have acne scars resulting from popping or sometimes just really bad acne, are there ways that they can reduce the severity or maybe entirely eliminate those scars to also kind of help in that healing process?
Absolutely. The number one, there's a few steps that I always share with my patients. Number one is that you have to heal the skin's moisture barrier. And that has to be done right away because the healthier your skin is, the less it's going to scar. And that's the same with your body. The less inflammation that you have in your body, the less it's going to scar. So that's always important to reduce scarring. And then once my patients have actually healed their acne and they no longer have active outbreaks, about active breakouts, the number one thing that I see time and time again for healing acne scars is medical microneedling. It's brilliant. This is not the same as doing derma rolling or microneedling at home because you need to have a long needle, at least 1 inch, to really see a lot of improvement. But if you go to your medical practitioner, your doctor, your medical esthetician, they can do that medical microneedling treatment. You probably need about 4 to 6 treatments to get the results you want, but that is by far the best treatment that I've experienced for scarring.
Very cool. And for women who are using hormonal contraceptives and are dealing with menstrual breakouts, how do you treat those? Because that's something that keeps up coming up in a cycle, right?
Right, so they're on the birth control pill and experiencing breakouts?
Yeah.
Okay, so the number one thing is that need to reduce inflammation in the body. Once you reduce inflammation in the body, you are not going to be as triggered for breakouts. When you're on the birth control pill, you know, because you have a lot of breakouts, chances are that the progestin that's part of the pill is called drospirenone, and that progestin is actually an androgen blocker. So it's going to help reduce the amount of acne that you're experiencing already. But if you're still experiencing acne on top of that, it is very likely that your body is inflamed and you need to bring the inflammation down.
Okay, awesome. And does sun exposure help with healing acne or can it make it worse?
Well, direct sun exposure on the face is, it can help, some people for sure. And, one of the reasons is because it creates natural vitamin D, which is very helpful for us. But, also exposing ourselves to direct sunlight can also create sun damage on our skin as well. So, it kind of helps, but then it's also creating another problem at the same time.
So would you suggest supplementing with vitamin D then instead?
Yes, absolutely. Definitely supplement with vitamin D. And, I do love getting natural vitamin D as well. But what I always get my patients to do, always put sunscreen on, cover up your face, and then 10, 15 minutes a day, expose the rest of your body to, to natural sunlight and make natural vitamin D that way because, I don't want them to get sun damage on their face. Other parts of your body, it's okay to get a little bit, but not the face, not the face. No.
And one of the things that they say is like a sign of aging is the neck, right? Because a lot of people forget the neck in their skincare routine. And the neck doesn't tend to get as much acne, but I know it can sometimes, right? There's other areas of the body that can get acne. So would you apply the same sort of healing techniques to other areas, like if you've got chest or back acne or anything like that?
Yeah, and that's a great question because when acne shows up in different parts of the body, it kind of signals, it signals something different. So for instance, if you get a lot of acne on your neck, then to me, in my experience, there's a lot of lymphatic stagnation going on in the body. So, with my patients, I'll really target more on moving the lymph. If I see a lot of acne on the chest and on the back, then chances are the microbiome is really out of balance. So I'll take a look at that and I'll do healing there. So I can tell, I've been doing this for 14 years. I've been looking at acne for 14 years. So I kind of have an idea of what's going on in the body just by looking at where the acne is appearing and what the acne looks like.
And so, what are your thoughts on skincare products that contain acne treating substances such as benzoyl peroxide or salicylic acid?
So benzoyl peroxide is incredibly drying. It's incredibly damaging for the skin's moisture barrier. I'm not a fan because part of what I do is I always want my patients to have healthy skin where the moisture barrier is intact. It's not dry, it's not irritated, it's not peeling, it's healthy skin. And benzoyl peroxide does not help with that at all. But I do like salicylic acid. Not everybody can tolerate it, so we start slowly to see what each person's tolerability is. But if you can tolerate it, it is wonderful because it's a fat soluble substance. It's a beta hydroxy acid. And so it's actually able to penetrate into the pores. So people that have a lot of pore clogging, such as blackheads, salicylic acid can be very helpful for reducing that.
Okay, interesting. And I know earlier you had mentioned insulin levels can be a big cause for acne. Do you mind elaborating a bit on this?
Yeah, absolutely. So when we consume too many simple carbohydrates, they convert very quickly into glucose. That's blood sugar. The blood sugar is elevated, and then what happens is that the pancreas produces insulin to help get that glucose into the cells of the body. And you know what the high insulin levels do is they produce a hormone called insulin-like growth factor 1. And insulin-like growth factor 1 actually directly increases androgen levels in the body. And androgens are the hormones that actually lead directly to acne. So that's the connection. And it's a really, clear connection. It's a strong connection. And there's been so much research that's come out over the past few years that's shown us that's what happens.
That's amazing. And so healing acne from the inside out or healing our skin from the inside out is obviously going to take time. It's not an instant fix. So do you have suggestions for people on ways to manage the acne in the interim while they're doing the internal work?
It takes time. It takes time. And, I get my patients on a very gentle, nourishing skincare routine to start because we don't want to be aggravating the skin by using the wrong skincare products. And that happens a lot. And gentle skincare is very helpful. But like you said, it's going to take time. And part of the journey is, developing patience and also learning to love ourselves no matter where we are in the journey. And I don't have magical cures. I don't have anything that's going to eliminate all acne overnight. And I think accepting that and learning to deal with that is such a big part of the healing journey. And, it's part of learning to love ourselves no matter what. So it's valuable.
And so you had mentioned you had a gentle skincare routine. Do you use actual skincare products that are on the market, or do you prefer to use household items to make your own skincare products? Like I know some people will use, for example, coconut oil on their skin, or maybe tea tree oil, things like that.
Yeah, I do a combination. I actually have a combination of products that I share with my patients. Some of the homemade, kitchen items that I really do love, though. I love Manuka honey. Manuka honey is one of the most healing things you can put on your skin. It's incredibly antimicrobial, and it's very calming. It reduces inflammation. I also love green tea. Green tea is an ingredient that's been clinically proven to actually reduce sebum production on the skin. So if you have very oily skin, spritzing some green tea on it is really, really helpful. Yeah, those are probably my two favorite kind of homemade things. I also love using a lot of aloe vera gel. That's fantastic. Um, yeah, tea tree oil, it depends. People that have very sensitive skin, often tea tree oil is just too harsh for them. It's not going to work. It's going to increase irritation. So you have to be very careful with essential oils.
Okay, and for diet and I guess gut health overall, do you look at food sensitivities and allergies as well when you're looking at causes of the inflammation?
I don't as much as I used to. And the reason being is when you're looking at food sensitivities, when you do an IgG food sensitivity test, it measures foods that your immune system is having a reaction to. But I find that many acne patients actually have food intolerances. They have difficulty breaking down certain foods in the digestive tract. And so I now do elimination diets instead of doing IgG blood tests to determine food sensitivities and intolerances.
Okay, and what are some of the best foods for clearing skin?
My number one favorite food for clearing skin is blueberries. I love blueberries. They naturally help to balance insulin and blood sugar levels. So that's one reason I love it. So many amazing antioxidants. That's one of my favorite foods. Another food that I love, cruciferous vegetables. Cruciferous vegetables are fantastic to help the body detoxify. And oh gosh, there's so many of them. Avocado is another fantastic food because it's so high in vitamin E and fatty acids that really help the skin, be moist and healthy. Nuts and seeds, they're also fantastic. I love having my patients consume a lot of those as well. Those are just a few. I have so many. I could talk about them all day long. You just stop me.
And then, do you ever use supplements as well to help with patients' diets, or do you prefer to go the whole food kind of route?
No, absolutely. I mean, I love diet, and diet is absolutely the foundation of the work that I do with my patients. But often, diet can only go so far, and there are organ systems that need to be balanced in the body, and that's when certain supplements are really important.
And for dealing with lymphatics stagnation, do you do lymph node massages, or do you prefer acupuncture, or do you have certain treatments that you find work well to get those moving again?
Yeah, I mean, oh, I love those treatments that you just mentioned. They're fantastic, but my favorite that I use with my patient population is complex homeopathy. I find that complex homeopathy is so amazing to help move and cleanse the lymph. So, but you know what? Dry brushing, we do a lot of that. We do a lot of castor oil packs. We also do some acupuncture. I love doing acupuncture, and massage is fantastic too.
Awesome. And do any other lifestyle changes such as exercise and sleep influence acne?
Yes, Yes, absolutely. I mean, without proper sleep, I mean, our bodies are just not operating at their optimum, they're not as vital at all. So we need proper sleep. It's essential. It's a foundation of health. And exercise too. We need to move our bodies, and that's part of keeping our lymph healthy. But, and this is interesting, I find that over exercising can be an issue when it comes to acne. When we over exercise, sometimes we produce even more cortisol, and chronically high levels of cortisol can be very triggering when it comes to acne. So exercise is important, but over exercising can be an issue.
Do you see a lot of patients with HPA axis dysfunction then?
Many patients have HPA access dysfunction, and we're working to heal the adrenal glands to reduce chronic cortisol levels all the time. I would say it's very rare to actually, see a person with chronic acne without having, some type of dysregulation in their HPA axis.
Okay, and on average, how long does it tend to take for people to notice a difference from their acne treatments?
It varies on what's actually the underlying cause of their acne and how severe their acne is. Some patients, they get complete clearing within 2 weeks. Other patients, it can take 3 to 4 months to really get complete clearing. So it definitely varies, but it takes time to heal properly, right?
Absolutely. And do you believe that we can prevent acne by kind of preemptively following some of these steps?
Absolutely. Absolutely. I mean, acne is a sign that there's an imbalance in the body. And, if we keep our bodies balanced and we support the organs that can be implicated in acne, then absolutely we can avoid acne. I 100% believe that.
Well, thank you so much, Stacey. This has been fantastic conversation. If any of our listeners wanted to work with you, how could they get a hold of you?
Sure. You can check out my website, naturopathicbeauty.com. You can follow me on Instagram. Naturopathic Beauty is my handle. And I have lots of videos on YouTube as well.
Awesome. Well, thank you so much for joining me, and thank you to the listeners for tuning in to today's episode of Supplementing Health.
Great. Thanks.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.